Hi, my name is Eddie Cardenas. I am a paramedic with American Medical Response, and today we're going to go over basic steps for bleeding control, including a tourniquet. We'll start from just something very basic. Let's say you have somebody who has an injury, but it's not a lot of bleeding control, and something that you don't necessarily would need a tourniquet on. And we'll go over as far as what things to look forward to, or what to look for if you're using a tourniquet. So if you have just some basic bleeding control that we need to do, we're going to use just a basic Kerlix or just kind of a roll gauze. And then what we want to do, the steps that we want to do is we want to use direct pressure and then a pressure dressing if needed. So we can use just a basic gauze as well. So one of these, we'll open this up. And let's say we have a injury to this person's leg. We'll say we'll go ahead and use this one from you guys' side. So first thing you want to do, and if you guys have gloves, that's something that you want to use as well. Just purposes of this, just for demonstration, we won't be using gloves. So what we want to do is direct pressure. When we get these roll gauze, what you want to do is you want to use it with the side so that you don't lose it. Because if you drop this thing, then you'll actually lose it, and it'll be really hard to actually put some good pressure on it. So what you want to do is you want to grab the injury, and then you already have your pressure on, and basically what you want to do is you want to keep putting pressure on this thing. Another good thing to do is to turn it as you're putting pressure, so when you turn it, this little side is going to be right on the injury. And that helps with putting some pressure. So maybe you could do a couple twists. And then once you think you have enough, you could either use the whole thing or use enough of it. Then you could use some trauma shears, which this will be something that in some of the kits that you get, they should have some trauma shears. Go ahead and cut this, and then whether you could use a piece of tape or another thing that we could do is you actually could cut a piece and then do one of these, where you could actually go in here and tie it. And so this will be your basic gauze, or your basic bleeding control, just using some gauze and a pressure dressing. Now with something a little more serious, so let's say you do have somebody who was shot, stabbed, or some type of injury where you see a lot of blood. And just for the layperson, just because we don't want to put too much responsibility on you, we're just going to say go directly to a tourniquet. So the way that we use these tourniquets, and we always want to recommend using a commercial tourniquet, and make sure that whenever you're buying these tourniquets, you're buying it from something that's dependable, not something that they're a ripoff or there may be counterfeit tourniquets. So this is called a CAT tourniquet, a combat application tourniquet. This is probably the most popular one that you'll see out in the field. There are many different types of tourniquets. But this is going to be the one that we recommend. Main reason why we recommend it is because this is really good for self-application. So if you yourself are injured and you have an arm possibly that you need to put a tourniquet on, this is going to be the easiest way to do it. So again, we're going to use a leg on this one. So the easiest way to do it, whether you want to just open it like this or whether you want to totally open the tourniquet, whatever is easier for you to do. The best thing that I recommend people to do is to practice with these things, because these things they're not complicated, but in a stressful type of situation, if you don't have enough training with it, you might get a little confused as far as how to use it. So what we're going to do is, again, using the same leg. And the best thing that we want to do, we always recommend on tourniquets just to go high and tight. If you picture your extremity that we're trying to put pressure on in order to stop the bleed, most important thing on any type of situation where there are some traumatic events happening, blood loss is going to be the number one thing that kills somebody. So we want to make sure that we stop the bleed as soon as possible. So the easiest way to do it, instead of trying to, whether the injury is low or a little bit not as high as you would think on an extremity, in order to put this tourniquet on very high, we want to make sure that we go high and tight. That's always the best advice that we want to give people in order to make sure that we stop the bleed. The higher we go, the vessels get bigger. And so if we just put it as high as possible, then all we have to do is clamp down that one vessel. So in the leg, the major artery that we're looking for is the femoral artery. which you could actually bleed out in minutes. So we want to make sure that we go as high and tight. So when we put the tourniquet on, we're going to go as high as possible. And then what we're going to do is once we get it through the first hole, what we're going to do is we're going to go as tight as we can to wrap this thing around. And the main thing that's going to stop the bleed is going to be this windlass right here. So what we're going to do is we're going to keep turning this windlass until we actually stop bleeding. So look for whatever your site is at, where the bleed is at, and you want to crank this thing until you see the bleeding stop. And once you see the bleeding stop, then give it one more crank, and then put it in basically this little place that you could put the windlass in. And then from there, what you want to do is there's also this little piece of little cloth that you want to essentially go over here where it says time. If you have a Sharpie, a pen, anything to mark the time, that's going to be very important because when this patient gets to the hospital, they're going to get an idea as far as what time the tourniquet was placed, so they know basically kind of how long. They don't usually necessarily want to keep tourniquets on. Usually it's like an 8-hour window that they want to kind of keep safe in, although tourniquets have been placed for a little bit longer. But it's very important to put the time as far as when you put the tourniquet in place. And I know there's a lot of stuff going on, so it's going to be a lot of practice and just getting used to putting the tourniquet and remembering to put the time and all that kind of stuff. So once the tourniquet is on, so there's two things that you're going to look for. A, the bleeding should stop, and then two, the patient should not have a pulse on that extremity. And so that's essentially how you know that tourniquet is on nice and tight. One thing to remember, especially for dealing with high school kids or younger kids, these tourniquets are going to be very painful. So making sure that you're monitoring this person at all times until EMS arrives is going to be very important, because this person is going to want to take this off because it's going to hurt a lot. So making sure that you're with them, checking their mental status to make sure that they're not getting confused, because one thing that does happen with blood loss is these patients might get confused, might start getting combative, that kind of stuff. So you want to make sure that you're keeping yourself safe, but also making sure that this stays on, because this is going to be very important. Once this goes on, this is not going to come off until this patient gets to the hospital. So this is going to be your tourniquet. Again, any kind of makeshift tourniquet. We will also show you how to make a tourniquet in case, let's say, for example, you do have more than one patient and you just have one tourniquet. Don't be alarmed. You are able to make your own tourniquet, which I'll show you here in just a sec. Again, there are different types of tourniquets as well. So other than the CAT tourniquet, there are many other ones that are out there. So just do your research and see which tourniquet maybe works best for you, and practice with it. That's the best advice that I could give as far as doing tourniquets, is just to make sure that you practice with them so that you get very comfortable. So when it does happen, when you're in that fight or flight, stressful type of situation, you're able to apply this thing with no issues. Now, if you don't have anything as far as a tourniquet, just using the same gauze that we just used for our simple bleeding control, we could also use this. And in this situation, I'm going to do a demonstration with using a carabiner and just a set of keys. Right? We all have a set of keys, carabiner, a pen, a wooden stick, basically anything that you can use. The main thing that we're using is you want to use something very stable that won't break. And so a carabiner is a good idea to use, because I could twist this thing a lot of times, and we'll show you exactly what we're going to do here in a second, and you don't have to worry about this thing breaking. Stick, a pencil, a pen, those are probably going to break. So anything that you could use in a classroom setting, maybe a ruler or something that is going to be pretty sturdy where it won't break, because you're going to be putting a lot of pressure when you're twisting this thing. So if we're going to be using some keys, again, we're just going to use, just kind of show you. So with the keys, what you want to do is you want to stick the keys in here, and I'll show you exactly why we're using some keys here in a second. And what we're going to do is essentially, now this is always going to go above the injury. So remember, we're always going to try to do high and tight. So just for demonstration purposes, I'm going to put it a little bit lower just because we already have a tourniquet on. So Again, you're going to make one quick tie, and then what you're going to do is you're going to get your carabiner, your ruler, anything, again, like I said, a metal pole that you could use. And what we're going to do is we're going to get this, and now we're going to tie this on as well. And now what we're going to do is we're going to use this as our windlass, and we're going to, again, keep turning this until we stop the bleeding. And once the bleeding is stopped, this is where the keys come into effect. And in the carabiner, basically what we're going to do is we're going to put the carabiner through there, and that should hold it so it doesn't unwind. So we all have a set of keys. From there, it's going to be, and again, this is why we call it a makeshift tourniquet. You're just kind of using anything that you can. So carabiners, you could find those at any hardware store, Amazon, any kind of stuff like that. And those are always a good idea to keep handy, especially if it's going to be one of those. And again, this would be a situation where possibly you already use your tourniquet. And also keep in mind that these tourniquets, especially if we're using it on a leg, let's say you have a larger adult, maybe a larger child where the bleeding hasn't stopped, because you can only crank these so far because it is plastic, so it can't break. So you might need to use that makeshift tourniquet on top of the tourniquet or below it to try to completely stop the bleed. And that might be something that's possible. So those are some ideas with that. So those are our tourniquets, our basic bleeding control. Now, there are other types of bleeding control that we have as far as pressure dressing goes. This is what's called an Israeli bandage, and the way that these will come packaged, depending on what kit you have. So there are some kits out there, some bleeding control kits that are pretty good, that have everything that you need. This one, for example, is one from North American Rescue, and has everything from your tourniquet, your Israeli bandage, some regular gauze, a Sharpie, basically everything that you need, some trauma shears, and even some gloves in there to help to basically have everything that you need. So whichever type of bleeding control kit that you have, or you can make your own. Again, these are some things that that you could put together by yourself, or if it's something that's given to you as well, you could basically pack whatever you need into one of these kits. So these are the way that these Israeli bandages work. I always like to keep them in my kit with this out, just because there's still an additional package that you need to open. And these should be kept in these packages just because it keeps it sterile. Because again, this is going to go actually on top of the bleed that you're using. So what you're going to do with this is you're going to go ahead and open it. And this part right here is what's going to go on top of the injury. So the good thing about these Israelis as well is it's hard to, you actually need to pull it in order to kind of take this apart, but it's good because it won't unroll on you. And so that's the good thing about these Israelis, especially, time of stress and that kind of stuff. You're frantically trying to just take stuff out. And so the good thing about it is it won't unroll on you, so you can keep it nice and put this thing on the injury. So what you're going to do again, this is going to go on the injury. Same thing, what we're going to do is we're going to roll this, and this piece of plastic right here, what we're going to do is we're going to feed the bandage through, and then you're going to go back. Now what you want to do is you want to essentially kind of move this if you can, because the whole point is when I move this thing back and I put pressure on here, I want this to be actually on the injury. So again, this is not a tourniquet, so the main thing for this is going to be for pressure dressing. And so what we're going to do is when we pull this thing back, this piece right here is we want to put the pressure right on the injury site. And then what we're going to do then is we're going to keep unrolling this. And you'll see as each time I put this thing, this little piece of yarn is going to keep getting pulled off, which is normal. So don't think you're breaking it or anything like that. And you're essentially going to unroll this thing and keep going until you get to the very end. And when we get to the very end, there's these two hooks that you're going to have. And so one hook is going to go on one end, and you're going to reach over, and the other hook is going to go on the other end, and that's going to be our Israeli bandage. So these things work really well with pressure dressing. So even if you have, for example, a tourniquet on, right, and let's say your injury is right here, whether it's, again, a gunshot wound or stabbing or something like that, whether you use regular gauze or you could actually put the Israeli bandage on the injury site so that we could control the bleed totally, right? Because this is going to stop the majority of the bleed. You might still have a little bit of bleeding from the injury itself, and so we could go ahead and apply that injury or that Israeli bandage over that injury, or if this patient has another injury that maybe isn't bleeding very much, to just treat that injury as well. So you have a lot of things to play around with, so just kind of practice with it, and when it comes down to that, you might mix and match a couple different things of how you want to do it. Obviously, the tourniquet itself is going to be for the major bleed, and then the pressure dressing is going to be for something a little more not as severe. So what happens if we have some injuries here in the chest? So there's a couple things that we want to make sure. Now this can get a little more complicated just because of the fact that there's more things that are going on here, right? This is very easy. We usually consider bleeding control a basic life support type of intervention, whereas something probably more in the chest area, torso area is going to be more of an advanced life support type thing. But that doesn't necessarily mean that there's nothing that you guys can't do in the meantime until EMS arrives. So if it's anything in the chest area, basically meaning that they're complaining of having a hard time breathing, or they're you see what's called a sucking chest wound. So when you expose this area, you might see basically it's some bubbling or whatever it is in the side of in the chest. There's two things that we could do. There's commercial, which there's one actually that comes in this kit, and what they call it, it's called a chest seal. And the whole point of the chest seal is that the reason why you see the bubbling at the side is because there's air going into the chest where it's not supposed to. And so what eventually that's going to cause is it's going to cause a collapsed lung, or what we call in the field a pneumothorax. And that could be very deadly for the patient if it's not treated right away. So if you do use a chest seal in the kit, there's instructions as far as how to use it. I'm not going to open this one just because, again, these chest seals are pretty expensive. So just follow the instructions on here how to use it. Essentially what you're going to do is you're going to put the opening. Basically what we're doing is that we're venting that chest injury. So when we put this on, air is going to be able to come out, but it won't be able to go in. And so what we want to do is we want to prevent this pneumo from getting worse and creating what we call a tension pneumo, which could kill this patient. Now, if you don't have a chest seal, you can use basically anything. The packaging from the Israeli bandage, you could use that. So if you have your trauma shears, what you could do is you could open this up, kind of get an idea of how big this injury is. So for example, let's say we'll cut this thing in half. So let's say you have enough for another one, just in case you need one. So the main thing of it is we're going to put this over our chest injury, and with some tape. So hopefully your kit also has some tape. Cloth tape is always preferred, but you can use any kind of tape, Scotch tape, whatever they have available. What you're going to do is we're going to tape this thing down on three sides. And the reason why we tape this on three sides is because essentially what we're doing is we're creating a vent. So again, when they take a deep breath out, air could come out, but when they take a deep breath in, it's going to prevent any more air from coming in. So you want to use a couple pieces of tape, and what we're going to do is we're going to tape this on three sides. And so once you do that, again, I'm not going to ask you guys to do much more than just that. Once EMS arrives, they'll assess the injury to see if there's anything additional that we need to do for this. But just doing that would be very helpful. Anything else in the torso area that is not an extremity, again, you see you have an injury to the abdomen or maybe to the shoulders. The main thing, again, any kind of pressure. If you feel comfortable enough to maybe get some gauze and pack the wound a little bit, then whatever it takes to stop the bleed. But really, the main thing that I'm going to have you guys do when it comes to something in the abdomen or like the shoulders where you're not able to put a tourniquet on is just put direct pressure. Anything that you could do to stop the bleed is going to help out. So same concept that we did with the pressure dressing. If you need to wrap it around the abdomen just to keep that pressure on there. The Israeli may work with smaller people. It may not be big enough to wrap around somebody that might be a little bit bigger. But whatever you could do to stop the bleed, that's all we could really ask. It is a big step, and I'm sure it'll be very stressful for you guys in that type of situation. So any help for EMS is greatly appreciated. Because the sooner that we can stop the bleed, the better outcomes for these patients when we get them over to a trauma center. So those are the steps as far as bleeding control. I hope you enjoyed the video, and I hope that this helps you in a real life situation. And with enough practice, you'll be able to apply this and hopefully feel comfortable with it. If you ever are in question, always remember direct pressure, pressure dressing, and then a tourniquet. That should help you out, and enjoy the video.